Good day, viewers at home, and you're welcome to another edition of Pertinent Questions. On Pertinent Questions, we ask questions that are pertinent to human, socio-economic, and political endeavors. Today, we are treating something that is very important to you and I. When you discuss the art, art is the powerhouse of the human body anatomy. It's the center of gravity of our universe, as it is. And that is the topic and the focus of our discourse today. I have someone in the house who is a world-renowned cardiovascular health specialist. And of course, he's from here in OSUN State. We are taking advantage that he's a son of the soil to interrogate him today on Western Spring Television. He's also the chairman of OSUN State Hospital Management Board. I'm talking of Dr. KINGSLEY AKINROYE. Sir, you're welcome on the program.
Thank you very much.
So good to see you, sir.
Dr. ADEFILA, it's a pleasure to be here again.
Is there a distinction, sir? Because what we are used to as laymen are cardiologists, now cardiovascular health scientists. What's the distinction?
Thank you very much, Dr. ADEFILA. As far back as not until a few decades ago, science is evolving, and the science of the heart, people who work in the area of the heart are called cardiology. And then you're either a physician or you're a surgeon. If you're a physician, you deal only with the aspects of medicine, the internal medicine of heart. Then when you evolve and you deal with surgery, the surgical aspect, you are called a cardiac surgeon. Then, but in the rest of it, because it's also a science, it's an area of science, there are people who are in the laboratories who are also cardiac scientists. As far even to the molecular level, also, but also in the area of, because you also deal with the people who are specialists in the area of cardiology, who deals with the internal medicine, are called cardiologists, and they deal with the patients. Right. The other ones, also surgeons, deal with the patients. But there are also areas who deal with the population. Right. Those who deal with the population are called the cardiovascular health specialists. Okay. So, which is also the area we didn't know like about 50 years ago. They have to deal with the areas of looking at the health of the population. Because when you treat the patient, they go into the population. Okay. So those people who deal with the population are called the cardiovascular health specialists. And they also deal with the policy. They deal with the care, they deal with the training, they deal with the planning, the interface with the government, they interface with the population, they interface also with the global arena. So everybody's talking the same language. So these are the people in that area that deal with the public health of the heart.
Oh, fantastic.
So they are planners, they are experts in their field, they also look at policymakers, they also look at the area of the training, the area of the research, they also researchers.
And it's not surprising, sir, that that's your area.
That's my area. That's
cardiovascular health science.
Yes.
Because I know you have been the president of Nigerian Heart Foundation, like forever. Yeah. And at the time, you were the vice president of the World Heart Foundation.
Federation.
Yes. Oh, okay. You have done so well for yourself in this area. Yes. And I know you are someone that everybody celebrates.
Thank you
as someone that is accomplished in this field.
Yes.
Now, Nigeria, looking at the Heart Foundation, how have you done in the area of advocacy for Nigerians to take their heart seriously and cardiovascular health-related issues?
Thank you very much, Dr. ADEFILA. Well, I was opportuned by divine to be at the inception of the Nigerian Heart Foundation, which was roughly about 35 years ago. And my position started as like a volunteer, and the president then was a young doctor who had just retired from the WHO. Then, now Professor Thomas Lambo, who started the initiative, and I was the vice president then 35 years ago.
Wow.
I'd never been a president of Nigeria. I was president for Africa, because we started also then when we started Nigeria. Nigeria was the first one before the apartheid, and we gave birth to about 15 countries, and eventually became the president for Africa. And then, like we just mentioned, I also on the global level, I also became the president, the vice president for the world, because we had a federation which is based in Geneva, and which we have about almost about more than about 150 countries.
Wow.
So I became the vice president. But what we do is that, like I just mentioned to you, we every country, they have a National Heart Foundation. So the National Heart Foundation is a body that puts everything together, like I've just told you. Look at the scientists, look at the area of training, interface with the government to make sure that things are also being done the way as laid down globally. And also focuses at research, also promotes research, promotes funding, also look at how funds are going to be made available. So we do advocacy, which you just mentioned. The advocacy at every level, at the state level, at the national level, at the continental level, like I was past president, so how to interface in terms of advocacy, then also at the global level. The realms of, for the Nigerian Heart Foundation is that the Nigerian Heart Foundation is dedicated to make sure that, to look at, because until about 40 years ago, 50 years ago, nobody knew that the black man suffers from heart disease. We thought it was only the disease of the white people. Then science now evolved that we also need to look, when we started to look at it, that the black man also suffers from heart disease. And the number one heart disease in the black population is hypertension. So the UN now looked at it and found out that...
I'm sorry to butt in. Are you saying that heart diseases are more prevalent in the Western world than on the continent of Africa?
That was the understanding.
That was the assumption.
That was the assumption 50 years ago. Nobody ever thought that the black people all over the world would suffer from heart disease. They thought the disease of the black man was limited to infectious disease like malaria, typhoid, tuberculosis, and all the. But gradually, we now see that the black people also suffer from heart disease. And the number one heart disease in the black population all over the world, including Africa, is hypertension. So when you now put all these diseases together, you now find that the number one cause of death and mortality, illness, is heart disease all over the world. And the developing countries, including Africa, 80% of those diseases happens in developing countries. And that is why advocacy is very, very important in terms of the aims and the objectives of the foundation, because you need to advocate with the government. You need to make interface with the government to be able to know that when you are doing your budgeting, when you are doing your training, when your universities are being created, you make sure that also that aspect of science is inculcated. Now, there was a time when we didn't have even like the area of specialty. We had less than very few hands people in the area of cardiology in the country. But now, with development, and we have more people who are science, all over the world we are well known, but back at home, it's quite a lot of difference. We just started, when the Nigerian Foundation started as far back as 1999, there was only one cardiac center in Nigeria. That was the University of Nigeria Teaching Hospital in Enugu. So we tried in as much as possible to attract world attention, to be able to see that we also work with the government of the country. Then there was during Professor Babangida to make sure that we also had a focus in that. But gradually, the awareness has gone up. Because what do? We also do a lot of health promotion. In terms of health promotion, you want a population to be able to know what to do to live longer. You like I just mentioned to you that the commonest cause of death is heart disease, heart-related. And when you look at our population, that is why you find that our life expectancy had always been below 55. We are just rising now. And when you compare us with other countries, like in the Scandinavian countries, Japan, and like Japan, you find out that the lifespan, if you are born in Africa, you will be lucky to scale the age of 60. Whereas in no other climate, like I've just mentioned, like the Scandinavian countries, like Iceland, Finland, Sweden, they live longer or Norway, they live longer to up to 70, 80, 90 before they die.
Doctor, I was coming to ask you about what are the most prevalent cardiovascular diseases in Africa or in Nigeria. But let me ask you, you just spoke about life expectancy in some countries of the world, in the West, in Japan, in Asia, and some other countries of the world, and compared to Africa. Is it about something about our gene? Is it generic? Is it genetical? Or is it about what we consume, our lifestyle, or non-availability of Medicare?
Well, it's certainly, number one, it's a combination of all of things. One, we've now known that heart disease is more related to some risk factors called lifestyles. Number one lifestyle is healthy diet. Unhealthy diet promotes heart disease. And in terms of a healthy diet, for the Africans, is salt. When you take too much salt, the more salt you take, the more damage you do to the heart. Then we talk of fat in the diet. We used to talk of cholesterol. Now we now talk of higher parts of cholesterol, which we measure. We talk of saturated fatty acid, we talk of trans fatty acid. All these ones are now damaging to the heart. So a healthy country is a country that recognizes that we must promote heart-healthy diet, which Nigeria Heart Foundation has been doing in Nigeria. And we are one of the ones that have been doing it in Africa. Then we also talk about physical activity. We know the more exercise you do, the more longer you are likely to live. Because the heart itself is a bag of muscle, which it pumps all the time. And the more it pumps, the more you are likely to live longer. That is why exercise is very important. Because when you exercise, your blood pressure drops. And that is that.
So I'm enjoying you.
Yes.
And that's very typical of you because it's your feed and it's just dropping, and I appreciate that. But let me ask you this. Typically, I love my African food. I love my pounded yam, my amala, my eba, my foruru, and most Nigerians, most Africans. And are you saying this diet that we love so very much, that we consume, because they are very sumptuous and they are beautiful delicacies, are they healthy or not as healthy?
Well, I want to tell you that African diet per se is very healthy because our diet contains of high fiber. And we know in science, in cardiovascular science, that the more fiber you take, the more healthy you are. But there are some other ingredients in our diet that are very dangerous.
Like salt?
Chemical, like salt. The other ones that are dangerous, sugar intake.
Where does the cholesterol
I'm just building that for you.
Okay, sir.
The next one, which used to, when we was training, used to tell us about cholesterol. But science have moved away from that.
Right.
And we now talk about the interest in terms of what you call some acids. Let me just leave it to me because some trans fatty acids, which you get from oil. And our number one oil in the country, which Nigerian Heart Foundation has been working on, say in the last 15 years, is palm oil. I mean, I tell you that because the Western world tells us that some other oil, especially soya oil, canola oil, sunflower oil, are very healthy because they contain some other products which are very healthy. But because they've done a lot of research, and Nigerian Heart Foundation 15, 40 years ago started what they call labeling. That if you buy a bottle of oil, you will find that there's a stamp on it which says this oil is heart friendly.
That's right.
And most of the oils that have been labeled by Nigerian Heart Foundation in the continent, in the border of West African oil, contains what I call the soya oil. But palm oil is not of soya variety. And palm oil, the world up to today believes that palm oil is not very healthy. And it's a big topic, but I just want to brief it that, palm oil tree was taken from Nigeria and went to Singapore, went to Malaysia.
And flourished.
And flourished. and did a lot of science, back with the research. But we in Africa, especially Nigeria, we have not done research at all. But Nigerian Heart Foundation, because we are global, And when we started labeling, like about 15 years ago, which Dora Kunyili was the one who started when she was, because we work with NAFDAC closely. We started labeling, we ran into challenge because the whole world started writing, WHO started writing to Nigerian Foundation about the criteria we were using. Why are you signing palm oil as being friendly? But we didn't have enough research because we are scientific based, and the only way that global science understand is research. So along that line, we have to say that empirically we backed palm oil use because there's not enough evidence to say palm oil kills. The Malaysians were with us. We were together. Malaysia, Singapore, New Zealand, Australia, we were together like about 10 years ago. Just to update you, we are now challenging our industry to do more research. But we have to be global. And so we are reviewing our own criteria to go along the world. We are not saying palm oil is not good. Palm oil is good, but we need more scientific research.
Thank you very much.
I want to limit you to that.
Doc, the saying out there is that a nation that wants to prosper economically, I want to flourish, to consume more of what it produces and less of what she does not produce. It is not a conspiracy theory propagated by the West to frustrate the consumption of our local oil. Because we have scientists. Why can't we do research into oil and try to standardize it? Do you think it's possible? Can't Nigerian Earth Foundation, in collaboration with scientists across the world, make it a thematic focus for a year and working in tandem and in partnership with a handshake with Malaysia so that we can achieve that? Is it impossible?
Well, Dr. ADEFILA, we are delving into
a controversial topic,
into a global issue. I just told you that Nigerian Foundation has been a standalone. The other foundation on the continent that was very close to us, is still close to us, is the Heart and Stroke Foundation of South Africa. And because the board of Nigerian Foundation, because palm oil originates from Nigeria, we've been at a very cross road to be able to promote science. We need our government to promote research, to tell the people that palm oil is healthy. But there's a limit to which we can carry because we are scientific based. We have to use what they call the global index. That's what is, people listening to me who are scientists, you know what I'm talking. That's what is called Codex. Codex is the international body that approves what you use in your food content. Because when you take a food, you will see some prescription telling you the content. So we have to go along with that. But at the same time that we know that we've been sympathetic, because NHF, Nigerian Foundation, has been sympathetic for the last 8 years, challenging the industry to do more research. But we cannot say because we are that there's no evidence, we cannot back it up. So you are saying that a country, I quite agree with you, a country that consumes what they produce, they do what?
Just they flourish. They prosper. They make money.
We know in the market. You can check that. The palm oil, we do not produce enough palm oil in this country. I don't want us to limit your discussion to palm oil alone. There are some other things. But we do not even produce enough palm oil in this country. And we will deal with about 3 companies that are signed by Nigerian Foundation. They import palm oil more than we produce in Nigeria. Okay, sir. As of today.
Let's the palm oil where it belongs.
We are not there. But it's just to tell people that we have a new administration and our Minister of Health, we are going to meet, we're going to go into that. We need to promote more research into palm oil. Palm oil contains a lot of ingredients that are not available in other oils, vitamins, natural products. But again, too, it is nice for you to be sympathetic, but you can only, because in science, you deal with data.
Not emotions.
You cannot deal with emotions. So the Nigerian Foundation cannot go along. We are challenging all over the world to get communication. So
thank you. Yeah, like we said at the beginning, Doc, Earth is the engine that propels the body. When the heart stops working, life goes out from a man. what are the most prevalent cardiovascular heart diseases that we have in Nigeria?
Okay. Right. The commonest or the most prevalent one is hypertension. That is the blood pressure, the heart generates pressure, and that is number one heart disease we have in Nigeria. We have the other one that is coming out, that is because the heart is a blood vessel. And we have disease of the blood vessels of the heart, which they get narrowed, and when they get narrowed, they can cause heart attack. That's what we interpret as attack, but we call it disease of the blood vessels of the heart. And that is one is also increasing in our population, be due to stress, be due to hypertension is one of the causes too. Then the other things we have also diseases of the heart muscle. That is also present in Nigeria, but that not as much. But number one really is hypertension. If we are able to be able to conquer hypertension, then we must have done a lot of good for the population.
Can we ever conquer hypertension?
Yes, we can conquer hypertension because it's preventable. Hypertension is preventable. I've just told you, what do? Make sure that you reduce the amount of salt you take in your diet. Make sure that the population exercises. Encourage the population to exercise from childhood. Make sure that the blood sugar in the blood is also regulated. It's not high, because all this damages the blood vessels. And I just mentioned to you too that the health system, because as you grow, your blood pressure increases. So the rise in the blood pressure in the population is what we scientists know that happens. But you may need drug for control of the blood pressure. But we do not manufacture drugs for hypertension mostly in Nigeria. Most of our drugs are imported. And that is the area where we also come in the National Heart Foundation, and also talking to the government to make sure that the people who manufacture drugs for hypertension, they are given moratorium. And we also encourage, of course, you know what is happening to our country now. A lot of pharmaceutical companies are running away from Nigeria. In the 60s, 70s, we used to have a lot of whatever was available across the continent is available in Nigeria. But virtually all of them they've left the shore of Nigeria. Most of the drugs, and we are not manufacturing on our own. And most of the drugs we bring in now are not the first-class drugs. There's drugs that are what do you call it? They are similar to the first-class drugs. So what we need to do is also to be able to encourage people to be able to do that. And also our health system is not encouraging. Our primary healthcare system, where the bulk of the population, they see patients. So we must be able to control, because these primary care centers, they are in the rurals, they are in the villages, but most of them we have not.
Are the most accessible to the people?
Accessible to the people. Our workforce is going low. We don't have nurses in Nigeria. We don't have healthcare professionals. Doctors are not there to be able to assist us to be able to do this. So we need to think out of the box. Countries have done it. India, they've done it. There are some other countries they've done it. Pakistan have done it. And we need to think out of the box to be able to maintain. I'm in Osun State now. I take this opportunity that our workforce is one of the poorest in the country. In Nigeria, and there was a time one of my teaching hospitals, when because I also do some research which I include Osun State. I won't mention the specialist hospital. Used to have about 121 medical doctors.
121 medical doctors.
One of my specialist hospitals in Osun State had 121 doctors who are medical attendants. Do you know the number of doctors we have now today? You'll be shocked that we have less than 20.
Sad.
Nurses, in that hospital too, we have less than 6 nurses taking care of the older. So Osun State is not alone, but because I'm there and I'm giving you the
data and the statistics.
I have the data and statistics. What is happening in Osun State is happening also across the board.
I don't want this to skip my mind. We'll be going on short break now. I want to answer this question in relation to hypertension that we mentioned. Is it generic?
Yes. I just want to, I will come back to that. Is that the reason why I mentioned the primary care centers is that the country is looking at it now, and we have an opportunity. We now have the National Health Insurance. We should make sure that the fund that is available in National Health Insurance are directed and are used, not only budgeted, the mission that used at the primary care center, and the country is going to benefit. So I go to your, yes, there's an aspect of genetics, that we know that genetics also, if your parents are hypertensive, your mother is hypertensive, you have 50% more chances of being hypertensive. But we also know that because of the environment, there's what you call modulation. If you have a twin here that is born in Nigeria, the twins are born in Nigeria, and one migrates to America, one is still living in the rural area, the chances are that the one that migrates, if care is not taken, will likely to develop hypertension more than the one that lives in the rural area. That is why we call about the environmental modulation of the genes. So it is recognized there, but because a lot of things are preventable, the genes are there, but once it is recognized, science has taken us to a level where a lot of what we are seeing today are preventable.
Thank you very much, sir. Before we go, we are going into your role as the chairman of Osun State Health Management Board after this break. Viewers, my guest has been Dr. KINGSLEY KOLA AKINROYE, a world-renowned and celebrated cardiovascular health scientist, and luckily the chairman of Osun State Health Management, Hospital Management Board. Don't go anywhere. Conversation around his plan for Osun State health-wise will be the next leg of our discourse on pertinent questions. Don't go anywhere.
The British Empire was the largest and the most powerful in the world. At its zenith, the empire embraced a quarter of the earth's land surface and imposed her imperial majesty's rule on more than 458 million peoples across nations and continents. The empire took off with overseas possessions and trading posts established by England, spread over 3 million kilometers between 16th and early 18th century. Like previous empires, the British Empire began to crumble on its weight of overstretched territories and growing unrest in our various colonies. Today, the British Empire no longer exists. What is in place is the Commonwealth of Nations, a loose association of sovereign states which recognize the King of England as the titular head. Western Spring Television identifies the British Empire as a watershed empire in history. Samuel Ladoke Akintola was a frontal figure in the historical moves that birthed an independent Nigeria from colonial Britain. As a freedom activist, he deployed his wits, energy, intellect, and oratory skills to prepare the grounds for constitutional talks that eventually culminated in the country's independence in 1960. The 13th Ààrẹ Ọ̀nà Kakanfò of Yoruba land cut his teeth as a politician when he became a foundation member of Action Group, the dominant political party in the Western region, and was elected the party's parliamentary leader of opposition at the Federal House of Representatives. The crisis in the Action Group, which pitched Samuel Ladoke Akintola against his leader, was not only a sore point in his colorful political life, but a reversal of gains which characterized the exemplary leadership of Awolowo Akintola premiership. 23 years after his death, Oyo State University of Technology Ogbomosho was renamed Samuel Ladoke Akintola University of Technology to keep his memory alive. Western Spring Television identifies Samuel Ladoke Akintola as a major character in history. Born Jeremiah Oyeni Obafemi on March 6, 1905, Obafemi Awolowo was a prime architect of Nigeria's independence and most consummate advocate of free education and social welfare in Africa's most populous nation. Erudite politician, thinker, and philosopher, Awo was fondly addressed by associates and political colleagues, brought his unique attributes To bear on governance in the defunct Western region, he administered as leader of government business and the premier between 1955 and 1958. Obafemi Awolowo's premiership witnessed pioneering in multi-sectoral policy initiatives and execution. The Western region under his administration paraded several enviable records. First television station in Africa, first real estate in Nigeria, first high-rise building in Nigeria, first modern sports stadium in Nigeria, first agricultural settlement in Nigeria, first modern civil service secretariat in Nigeria, and first industrial estate in Nigeria. His face is on 100 naira denomination as a mark of honor for his distinguished services to his country. Western Spring Television identifies Obafemi Awolowo as a major character in history.
Welcome back. My guest, Dr. KINGSLEY KOLA, is very much in the house. Like I said, he is a cardiovascular health scientist and, of course, the chairman of OSUN State Hospital Management Board. So, the first leg of the discourse was on your cardiovascular health science and your expertise in that area. Now, we are delving into your responsibility as the chairman of OSUN State Hospital Management. I want to say congratulations, sir, for coming on board, and I want to salute your patriotism for accepting that responsibility, because I know you are well sought after in legals and across the world, but you are giving back to the society. We salute your patriotism and commend you for the acceptance, sir. Now, what is your vision? I can be asking you, this is a field you know very well. You are a trained medical doctor, you are an expert, and you are one of the high flyers in this field. What is the problem that you have identified as a major problem that we need to tackle? And I want to ask, are you primarily in charge of primary health care alone, secondary health care, or tertiary health care system?
Good afternoon, Dr. ADEFILA, and thank you for this invitation. It's a great opportunity, and I thank you. By my training, I'm a cardiovascular health. I'm a physician, and I had the opportunity to serve as the chairman of OSUN State.
Yes, that's the second coming.
Management board from 2000 to 2008. And when I resumed 2008, before the last administration of People's Democratic Party in 2011, it was an opportunity for me. And I would say that now coming back 50 years ago to the same seat, it's a greater challenge for me. Because I got to understand that during that period when we were away, when I was out of that desk, the portfolio was vacant. And what does that chair mean? The chair is to look at the primary health care system in the country, in OSUN State. We have 3 levels of care in health. We have the primary level, we have the secondary level, and we have the tertiary level.
Mm-hmm.
The board essentially looks at the secondary level, but in the secondary too, we have 56 health facilities. So we're supposed to look
general
at
hospitals,
comprehensive health centers, general hospitals, and the specialist hospitals. And when I left, the teaching hospital was just coming on board, and it was still evolving, was under the But now we now have a tertiary system. We have now OSUN teaching hospital, which is on its own. But globally, the weakest link is the relationship between the primary, the secondary, and the tertiary. Usually, the referral system in Nigeria is 0. So if you do a care for a patient at the primary, you are supposed to refer to the secondary. The secondary, when they know their limitations, supposed to refer to the tertiary. But that referral system doesn't exist at all. And when it doesn't exist, you cannot talk of a system. So the health system in Osun State needs to be revisited.
Can I ask you this question, sir? What is the reason for its non-existence? If the referral system is very keen and germane to good Medicare delivery system, why is it missing?
Well,
lack of synergy?
There's lack of synergy. I also let you know that the edict, the law that established the hospital management board in Osun State, still being used today on paper, was 1978 law.
1978 law.
So that needs to be revisited because you need a statute to be able to operate. And even partners looking at you, they need to see your statute to be able to relate with you. So what is my vision? Just to let you know, because we are limited. My vision is to be able to make sure that we have an effective healthcare delivery in Osun State to the benefit of the population. I was opportune to serve on the transition committee. And it was then it dawned on me for the first time, even though I'd been out of Osun State, because I'm also involved in research. And I do international research, global research. And by that, I've been able to work with Osun State, even though when I left. I've now been able to say that Osun State is, if you want to rate it in Nigeria, in terms of health indices, is about 32, 33 out of 36 states.
That is
we have the poorest index for the care for maternal care. Children's care is poorest. And not only that too, we have the highest level of even infectious disease and tuberculosis in Nigeria. Our care for hypertension, diabetes is one of the lowest in Nigeria. And but I'm not surprised. The primary care board has not existed for the past 10 years, essentially in Osun State. Osun State. So our workforce is very low in Osun State. I've just mentioned to you, the number of and apart from that, our doctors are also
living in droves.
They are living in droves, and again, we are not having enough. We are not training doctors. We do not have a Nashubia, which is our trainings for doctors. We have lost our license to train doctors. We lost that about 3 years ago. Then we are not even getting NYC doctors into Osun State, because our NYC doctors that come into Osun State are one of the least paid in the country. So what is the attraction for them to come out? So a lot of them get their letters, they get to Osun State, and then they move. So you can see that we are the lowest ebb, and that is the reason why we are the lowest ebb. So we really need to rethink. We really need to refocus. And that is why we are calling for a health summit. We need a health summit in Osun State. All of us need to call on the table. We have, and also invite people. We have a lot of Osun indigenes who we have trained. They are all over the world. And a lot of them also want to come back. They want to come. Everybody wants to serve your state. That's why I left Lagos to come and serve Osun State. Because I believe that having made impact at the global level, one of my satisfaction is to serve my people. And I'm not the only one. All of them that are there, everyone wants to serve. So let us have a health summit where we talk. We can only help each other. We are not going to ask anybody to come from Saturn to come and help Osun State. We have enough people who are, in terms of human resources, and the money is there. I can assure you. So, and how much money do we need? So we need to rethink. So we need a health summit to be able to revitalize the primary system in Osun State, the secondary system in Osun, and even the tertiary. We are just very lucky. I was very happy during the transition and find out that we are the a magnanimous philanthropy that has donated a huge tertiary center to Osun State. That is Alakija Foundation. They've donated. I don't know, when I entered that structure, I was marveled.
Huge.
But hospitals are not made by buildings. Hospitals are not made by instruments. You need a personnel. You need personnel that are well trained, and we need to retain them. We need to retrain and retrain.
Doc, it occurs to me that your plate is full. You have enumerated the problems, you have listed the challenges that we have, and now Osun is lacking behind in rating, in data, in statistics. What will be the low-hanging fruit for you?
Well, the low-hanging fruit for me first is that we need to get across. Everybody needs, like you and me are being educated. I'm learning from you, you're learning from me. Everybody needs to be aware. And our policymakers, which I'm a politician and I'm also part of the system, we also need to recognize it, that we are at this very lowest level that we can be. And yet, Osun State is blessed. The Osun, the university, the OAU teaching hospital is just around the corner. The Ibadan teaching hospital, the UCH is behind us. We have a lot of other teaching hospitals around us. These are the people we can bring in to come and assist us if we give the environment that is conducive to them. Everybody wants to serve. So we cannot train doctors, we cannot retain nurses. So what are we doing? Only the buildings are just empty. No. And yet, too, we have, I'm sorry to stop you.
No problem.
We also have the blessing that we now have the National Health Insurance Scheme. The National Health Insurance Scheme gives us a bedrock. Money is supposed to come from Abuja to Osun State. If properly used, our primary health care system is not supposed to be in the state that it is. Our secondary health care system is not supposed to be in the state that it is. But I know my government. I know because I'm a politician. I know we are accountable. I know my governor is very ready to, is willing. I met him just last week. We had a chat, and it was just feeling bad like me. And I know when we do a health summit, that is the importance of it. We are not going to be talking ourselves. We bring in people, experts in. We bring in experts to be able to see our problems, and we put it on the global picture for people to come and assist us. We know we can do it. They weren't going to do it, and we, like I just said, we have Osun indigenes who are professionals all over the world.
And don't you think, sir? I'm sorry to butt in. We operate a constitutional democracy, and legal framework and legal backbone is very important. Don't you think you need to tinker with the 1978 law? That is outdated and not dynamic.
Well, I must give kudos to the last administration. The last administration looked at the Osun State Teaching Hospital has just been revamped. That was done just before we came in. The primary health care, because of the impact from Abuja, the Osun State Primary Health Care Board has just also, there's now a law that establishes that. But that of the secondary system, that is the Osun State Hospitals Management Board, is obsolete. So you cannot, there's no relationship. And when there's, you have three partners, and one, the one that is supposed to relate with the upper one is weak. So when it is weak, that means the chain is very weak. So we need to talk to each other. We need to look at it. So I just believe a way out is to be able to look at the system. We need to retune our system. We need also the workforce to be built.
How do you attract the workforce? How do you ensure that you pay the appropriate rate that we attract and motivate doctors to come and work for you, and nurses to stay put and not japa?
Sir, I trained in Nigeria my first degree. I qualified in Nigeria my first degree. When I qualified in the mid-70s in Nigeria, people were looking for me as a medical doctor. I had to choose where to work. By the time I qualified, I had a house waiting for me. I had a car waiting for me, and I was not the only one. So it was like, and when I went to England to train, it was the same situation. I had to choose where I was going to work. To get a house is not a problem as a medical doctor. to get even to fix your family and everything. So that's what we need to do. We need to think outside the box, and it can be done. And I think my governor is a very listening one.
You know, it's not just the health sector alone. The education sector.
I want to tell you that
even the media sector.
Health is
wealth.
Not even is wealth. Health is first. If you do not have health, sir, you won't be here today. If there's headache or there's stomach pain, you will not be here. So health is first. Even before education, you need to be healthy. You know what happened, what our Papa Wolo, what everybody did. You are talking about hypertension. I'm almost going to that. When I was in school, when I was in primary school, my mom, before I go to school, will give me Livaquin, everything free. That is what we should do for hypertension. Hypertensive drugs should be free for everybody. Because there's no family you go today that 3 out of 4 in a family, they have hypertension.
Doc,
and how much is the cost? How much is the cost of it? How many can afford it? It costs you average of what? 18,500 per month. For a family, for an individual to treat hypertension effectively. Who can afford that now from your salary? So rich people like we can afford that. 18,500.
I'm not rich. I'm an average Nigerian. So, this is a story that touches the heart. And I wish we could continue for the whole day, but my directors are after me that our time is up. Doctor, I want to thank you.
Thank you very much
for coming on Pertinent Questions. We've learned a lot. I wish you the best of luck in revamping the health sector in Osun State. It's a task that must be done.
I know my governor is ready.
The governor is ready, and you are ready. So it takes two to tango and to achieve success. I want to thank you once again for coming. Viewers, my guest has been Dr. KINGSLEY KOLA AKINROYE, a cardiovascular health scientist, a celebrated one for that matter, and the chairman of Osun State Hospital Management Board. On Pertinent Questions today. Until next week, when we shall bring another equally qualified and competent person to interrogate issues on Pertinent Questions. I remain yours sincerely, FEMI ADEFILA, saying next week is another day. See you there.